So my name is Matthew Lambert. I'm consultant in medicine for the elderly and stroke, and also clinical lead for stroke in Ninewells. At the moment, both in Perth Royal Infirmary and in Ninewells, the stroke service is very much a 9 to 5, Monday to Friday service. And we spread our workforce across those two sites to run two separate services. Patients, if they present on a Friday evening, for example, at 5 o'clock, won't see a stroke specialist until at least Monday morning. And we want to change that so people have access to a stroke specialist sooner. The only way we can really do that is to reconfigure our services. We only have a finite number of stroke specialists in Scotland, and so we have to make best use of the team we have. So the changes we're proposing to make are for patients who currently are admitted to Perth Royal Infirmary when they first have their stroke, for those patients to be admitted to Ninewells instead, so that they have access to the stroke specialist 7 days a week at the weekends, and also have access to a stroke specialist out of hours, which currently none of the patients in Tayside have. For the patients who currently are admitted to Ninewells, those from Dundee, from North Fife and from Angus, their pathway will be unchanged. It will be as they currently do, but they also will benefit from having access to stroke specialists at those times when they currently don't at the moment. So what it will mean for patients is that currently those people who are admitted to Perth Royal Infirmary with a stroke, they will be admitted to Ninewells instead. That averages about one patient a day on average throughout the year for their initial part of their management. Once they have had that initial assessment and a management plan and their initial investigations, we will then step them back down to Perth Royal Infirmary, to the stroke unit in Perth Royal Infirmary, after about 48 to 72 hours. If they're needing ongoing inpatient care, they will receive that in Perth Royal Infirmary as they do at the moment. So the stroke unit in Perth Royal Infirmary will be staying open. It's that very first part of the people's journey that is going to involve the change of where that's going to be delivered. The main benefit is that all patients who present with strokes, they will have access to a stroke specialist whatever time of day they present, and if they present at a weekend, they'll have access to their decisions about their care will be made by a stroke physician, stroke specialist from the outset, which currently doesn't happen. It also means that in the future we're setting up to be able to deliver a new treatment called thrombectomy, which is mechanical removal of blood clots that cause strokes, which some patients would benefit from. This is currently service not available anywhere in Scotland, but we've got plans advancing to be able to deliver that in Tayside. And to be able to do that, to prepare ourselves for that, we need to have a service where a stroke specialist is involved in people's care 24/7. So some of this also future-proofs us for future plans to be able to deliver improved care for patients as that becomes available. So if you want to find out more information about this, you can visit the website, which is transformingtayside.scot.nhs.uk.